Dental implants are one of the best treatment options for replacement of missing teeth. Hi friends, I am Dr. Mukesh Asrani, an oral medicine specialist, and let's begin our journey for learning in dental implants. The implant mainly consists of an implant post which is made up of titanium. It is inserted into the bone. We can see the threads. Bone is formed around these threads. It takes around 2 to 3 months for the formation of a bone, and this is how implant gets encouraged from the bone. The other part is implant abutment, which fits partially into the implant, and the remaining portion remains in the oral cavity on which a prosthesis is made. Now let us see how a dental implant is placed. You can see here is a single missing tooth. We take a pilot drill and make space for a dental implant. This pilot drill is followed by sequential drills according to the size of a dental implant. Now a dental implant is placed. This implant is kept in the bone for around 2 to 3 months, following which an abutment is placed on the implant. Once the abutment is fitted, a crown is placed on the surface of the implant abutment. This is how implant in the bone looks like. After some time, there is formation of bone around the threads of an implant. We can compare this with the adjacent natural teeth. The natural teeth are encouraged to the bone with the help of periodontal ligament. It is a firm and resilient structure which connects the tooth to the bone. In implant, there is no such periodontal ligament. Implant is directly encouraged to the bone. So this was the case of a single implant. Implant can also be used for multiple missing teeth. Now this is a case of missing 4 anterior teeth. We have placed 2 implants. These are the implant abutments, and this is the implant supported bridge. This is how the bridge fits on the implants and the final result looks like. If all the teeth are missing, then we have two main options. One of them is implant supported overdenture. In this case, we can place either 2, 3 or 5 implants on which overdenture abutments are placed and an overdenture is fabricated on them. Overdenture is a removable denture which fits on these abutments. It has an extra advantage of increased resistance, stability and support. This is how an overdenture placed on the implants look like. The second option for an edentulous patient is full arch supported fixed teeth. Here, 4 or more implants are placed within the bone. For example, in this case, we have placed 6 implants, followed by abutments over the implants, and a fixed bridge is constructed over them. Unlike overdenture, this remains fixed on the implants. So in this video, we learned about replacement of a single missing tooth, multiple missing teeth, or a full arch with implants. I hope this video was informative. Please like our video and subscribe to our channel and keep watching for dental implant related videos as well as other dentist related videos. If you have any questions, feel free to ask in the comment section. Thank you.